utterance is not yet updated in the portal, sir. Once the utterance is updated only, we can give the feedback. After submitting the feedback only, we can take the test, sir. All are interlinked.
Okay, we will check and let you know.
Okay, sir. Thank you, sir. Thank you, sir. Thank you very much, sir.
Dipankar sir, are you here? Dipankar sir, Professor Dipankar Chatterjee.
Yes, sir.
Okay, our next session will be started soon. Welcome, Avik sir. The moderator for the next session is Professor Dipankar Chatterjee. I hand over the session to Professor Dipankar Chatterjee. Dipankar sir, please.
Thank you, Subrata sir. It is my pleasure to welcome you in this exciting seminar on AI and quantum computing in healthcare startup. Actually, AI and quantum computing are revolutionizing healthcare startup by enabling advanced data analysis, personalizing medicine, and drug discovery. Together, they accelerate problem solving and innovation, addressing complex medical challenges with unprecedented efficiency. Today, we have the honor. We have the honor of hearing from Mr. Avik Ghose, a visionary in this field of technology and innovation. Welcome, Avik sir, in this session.
Thank you.
Mr. Avik Ghose currently is principal scientist and research head, healthcare medtech, TCS. Mr. Avik Ghose received his master degree in the year 1999. He has more than 20 years of experience in embedded system and has been with TCS Research since 2006. His area of research in human sensing, and he currently head as a research program called Connected Digital Health with aim at improving quality of life using digital technologies. He has more than 100 grant patents, and this is a big number. We welcome him in this session. And before that, I would like to request our principal, Professor Dhubasi Sarkar, to say a few words regarding our resource person. Sir, Dhubasi sir.
Thank you, sir. I think I am audible.
Over to you. Yes, sir, you are audible.
So, first of all, our sincere thanks and gratitude to Mr. Avik Ghose for accepting our invitation and what is not mentioned in his profile, that is like shared by Dipankar sir, is that very recently Elon Musk has shared a list of the impactful patent across the globe, and from TCS, from India, very few of them are listed, and from TCS, two people to know, I know very closely. One is Dr. Arpan Pal and another is Mr. Avik Ghose, and we are proud of you, both of you. So I'm sure this session will be an exciting one as always. And we're looking forward also in future a kind of support like to extend our institution, because such kind of support we always get from TCS as a whole, and I'm sure like we'll receive such kind of support in future. So all of us, we are eagerly looking for your session. So without further delay, I just conclude my speech here and request Dipankar sir to start the session. Dipankar sir, you are muted.
Avik sir, you are welcome, sir, and all of our speakers are waiting for your valuable speech, sir. Please let us know about everything what you want to deliver, sir. Thank you, sir.
Definitely. Let me just start
Over to
by
you, sir.
sharing my screen.
Professor Ghose, like Mr. Ghose, you'll be excited to know that close to 160 plus attendees across the country from 60 different institutions are attending your session. So thank you.
That's great. Thank you. So I hope you can see my screen.
Yes, it is visible.
Okay. So my session will be on AI and quantum in healthcare startups. But before going into the startups, let me tell you something about what we do. So, a brief was given by Professor Dipankar. So our area of connected digital health actually looks at how do we use digital technologies to improve quality of life. And in that respect, we look at a lot of areas in healthcare, including cardiology, neurology, musculoskeletal, and new ways of sensing biomarkers, which may include sensing of nano sensing, quantum sensing, hyperspectral sensing, and all. We have some new way of analyzing data as well. For example, we worked during the COVID to analyze how we can use location data or travel data for epidemic risk modeling, how we can use lifestyle data for generating wellness scores. As you know, there is no India specific wellness score at the moment, and that is what we are trying to build. Right. Another important source of data again for AI as well is the medical images. Right. So we have a lot of solutions around this anatomical landmark detection from X-ray images, or how do we, identify some of the markers like lesion or HBPG from the CT scan. How do we enable low dose scan, because that reduces the ionic radiation risk while maintaining the quality of imaging. And here are some technologies that are normally used to in healthcare, like digital twin, neural architecture search, and the use of wearable devices, vision, which means computer vision, right? Genomics, metagenomics, and also proteomics, we call it like omics as a whole. Medical image processing, definitely. Then again, when you are working on AI in healthcare domain, there's a lot of focus on how do we make that AI causal. And when we say causal AI in statistics, and when we say causal AI or explainable AI in healthcare, there is a slight difference. When you say causal AI in statistics, it means that what are the causal factors for a particular event. For example, if you say that somebody has a PhD degree and their chances of doing better research is better, that kind of causality can be found. But in case when you predict something, or in the, let's say, the cardiac space, the doctors want to know what is the pathophysiological basis of your prediction, right? So the causality has to be in clinical terms. That is a big difference. Obviously, behavioral sciences. Now, behavioral sciences, why do we use behavioral sciences in healthcare? Obviously, it's a no-brainer for mental health, because we detect symptoms like stress, anxiety, and we nudge behavioral changes. But if you look at chronic diseases that take a long term, including cancer, right, there is a high dropout rate. Why? Because people get frustrated with the lifestyle changes and the regime and the medication. So this keeping them afloat, keeping them tied to the compliance, the adherence to the plan. is all one challenge that can be solved by digital means through apps and devices which actually help you maintain your lifestyle, help you through the therapy. So now we can't talk about AI without talking about the data, right? So to understand what AI can do in healthcare, we have to understand what kind of data is used to actually run this kind of AI. So one strong data point that we see across, that is also one of my areas of research, is around biomedical signal, right? So when we say biomedical signal, it can be CG signal, which I think all are familiar with. PPG is the pulse signal that you get in pulse oximeters or smartwatches. So the principle of PPG is that you shine a light onto your skin, and when the light reflects back to your body, or the light scatters to your to the other end, you have a photo detector that identifies the intensity of the light. Now the thing is, the intensity of the light varies according to the volume of fluid present in the tissue. It may not be blood, but actually fluid. But the predominant fluid in our body is blood. So basically it captures the blood flow pattern. Now the blood flow in the body is the pulsating nature, at least the frequency of the blood flow, or the variational nature of the blood flow is governed largely by the cardiac pumping, right, the S1 S2. So PPG actually tells you a lot about the pulse, that is our heart rate, and that's how you, these smartwatches, measure your heart rate, right? So apart from heart rate, it can also measure, as you know, SpO2, which is the oxygen content. Some use 2 or 3 wavelengths to measure something called VO2 max, which is very important for athletes. Right. Similarly, another signal is the sound signal. Now, sound can be used to measure speech as well, but when we talk in cardiac terms, it's the stethoscope signal. So suppose you have a wearable stethoscope and this patient has a history of murmurs, then how do we identify murmurs from that heart sound, right? So that is another place where AI can help. EMG is the equivalent of ECG in the muscle domain. So when we say muscle domain, it means that it captures the muscular activity. So for patients who have like stroke or who have trauma or muscular spasticity, like patients who have this any kind of spasm, may be caused by muscular dystrophy, atrophy, different kind of disorders. Um, this EMG signal can give the level of muscle activation that happens in them. Similarly, EEG gives the equivalent electrode reading for the brain. So as you know, brain is the highest electrical organ in our body. So EEG actually looks at the spatial distribution of electrical activity in the brain, and it can be used for, again, a lot of purposes like sleep study, epilepsy. A lot of predictive model for seizures have been built on EEG data. Similarly, if you look at the other forms of data other than signals, there's a one big chunk of categorical data that exists. So with the advent of EHR, EMR, this exists now in digital form. One is pathological data. So whenever you go for a blood test or anything, your pathological data exists as readings. For example, your very common is your blood sugar, like your 160, 120, that kind of blood sugar levels will exist, and your metadata. When I say metadata, it means basically your history, your symptoms, your maybe your blood pressure, your fever, your temperature that you have taken. These all metadata, and definitely your history, like a person who has a very frequent history of infections, then it tells you something about that person's immune system, right? It may be a little weaker. So all those data is also very important. Then comes the text data. Now this text data essentially exists as 3 forms. So one is definitely EHR, EMR, which is the prescription part. The other is EPRO. When we say EPRO, it's basically patient reported outcomes. So what does it mean by patient reported outcomes? Is like, I took this pill and then my headache was gone after 2 hours. That's an outcome of that medication. So you can capture that face to face with a physician. Often asks you, like, how do you feel after taking the medication, or what happened after you slept for a longer duration, or you slept early. So those outcomes can be captured in electronic form and can be analyzed using AI. The other very important form of textual data that exists that is often neglected is the nursing notes. So whenever anybody is admitted in the hospital, you will see one little writing pad that hangs from every patient's bed rest. So that actually the nurse's observation of the patient that the doctor comes in when he or she gives the round and looks at to get a idea of the patient. Now these nurses are very expert, like they are just next to the doctor in the care continuum, and they, when they prepare these notes, they not only capture the readings that are there in the monitors and all that, they also capture their observations and their inferences for the doctor, to help the doctor actually. So this is very valuable. In fact, one of our research, we show that when the person is admitted, the first day nursing notes that the nurses create is so valuable, it can actually predict the length of stay in ICU for that patient using that data alone. Right? So imagine the amount of information that is captured in a very haphazard handwritten kind of way on temporary paper. Then another one, I think this is most popularly used, is the image data, which is like the X-ray, CT, MRI, video. Partly because with the advent of UNETs and capsules, deep learning has shown excellent results on medical images, and this has increased the popularity of the medical image processing using AI. And papers have shown that these things actually beat the radiologist at some point, right? Though I disagree with the part that they beat the radiologist in their understanding, they beat in their observation, because AI is very diligent when it observes. So the next one, again, I think is less talked about or less utilized, is speech data. So speech not only can identify speech disorders like dysarthria, stammering, and all those stuttering kind of problems, developmental issues, one big thing that it can capture. It can also capture some things that have not been explored to a certain extent, like pulmonary diseases, because we breathe as we speak. If a person is speaking, you can catch their breathing pattern from there, and from there you can get early markers of things like COPD or asthma, and then you can also get ideas of neurological disorders. So your Parkinson or certain diseases not only affects your motor function of the hands and the feet, they also affect your motor functions of the vocal cord. And people have said that speech and olfaction are two places where early signs of Parkinson can be found. Again, another thing is sleep apnea, which can be determined from speech quality. So the other one, again, is mobility data. As I already talked about, that location traces can tell you, your risk of infection, how many crowded places you visited, for how long were you exposed to how many people. So the kind of thing that that Arogya Setu was trying to do, we also created a similar technology which was called Proxy Track, right? And it won the IoT Breakthrough Awards in 2022, I think. Um, so that was basically what Proxy Track did. Was it tracked people in real time, and it could give you real time alerts when you get too close to people. Rather than just contact tracing, it was used to alert and avoid contact. Similarly, motion sensor data can tell you a lot about your ergonomics, your spine, your hands and feet, how they are moving, hand-eye coordination, and all. I will show you some of these, and also your your when you have diseases like stroke or Parkinson, your mobility patterns, like are you having tremors, can you reach where you are wanting to reach, all these simple things it can capture. The other one is radar signals. Now, when you talk about radar, it has multiple dimensions, and that's why I haven't written much here. So basically, radars can do a lot of things, from assessing human activity and location, right down to internal, like in-body imaging. Now, radars have not been utilized fully in the healthcare data. It's just starting up. The biggest advantage that you get is that you can get in-body imaging that is not only non-ionizing, because it doesn't need that much of ultrasound-like expert to actually hold and calibrate the pressure on your on the probe. It is something that you can put at the patient's home. So imagine if you have a knee replacement. Every 2 days, you can sit in front of a radar, which is given to you on a lease, and you can just take the image of your knee and send it to the physician, who can take a look how the knee is progressing, how the implant is it moved from its place, is the cementing getting loose. So all these early issues that happen can be now predicted and mitigated at an early stage. Okay, now we have talked a lot about discriminative AI. So again, when we look at how generative AI can be used, so this is very important because generative AI is slowly proliferating multiple domains, including healthcare. So if you look at generative AI right now, it is like text-based, like pure text-based, like GPT kind of models, or multimodal, like Midjourney kind of models that can generate videos, audios, multimedia data. So if you look at text-based, the biggest application is in two places that we are seeing. One is prescription assistance. So it may not occur to people like us, but semi-educated or little educated people often have a very big difficulty in understanding the prescription and assimilating why he's or she has been given so many medications, or why he or she has been prescribed so many tests. So both the diagnostics as well as the prescription. You will always see, often see, there is a notion that doctors over prescribe tests and over prescribe medication for their own profit. So that is basically because of the unawareness, right? That why this test is needed. So it is because the doctors don't have the time to actually sit down and explain to the patient their entire thought process and all this while describing while prescribing a text. Sorry, not describing, prescribing a text. However, this task can be done by a text-based, like large language kind of model, because they have the ability to, given if I give a like a test or something, it can tell me exact description of why in which cases this kind of tests are used, and for the given condition why this test may be required for the given set of symptoms. Similarly, for the medication, it can tell you a lot about the usage of the medication and its applicability to the patient. So therefore, it becomes a very helpful tool which may increase the doctor-patient trust, or the doctor and patient party trust, right? Which is a very important factor in treatment. The second part where it can be used is digital labeling. So again, if you look at the way labels are designed, like may cause nausea, this, that, all these jargons are good for educated people. For little educated people, actually, these side effects, they are largely unaware of, that what can happen, what can go wrong, and if something goes wrong, what to do, right? So again, there, now we are knowing that these LLMs are also coming in Indic languages. They can be used to provide beautiful digital labeling, whereby you know exactly what can go wrong with the medication, when or when not to take this medication, and if something goes wrong, what to do in that case, right? So this is where a lot of help can be done using generative AI. Again, if you look at the multimodal AI, then it can be used to generate patient awareness. Like we see a lot of these campaigns that are run by ASHA workers or this, that around. Now, generative AI can be easily used to create very, very engaging content given a purpose, and which can be used to raise patient awareness. These kind of apps are very, very in necessity, because it has been shown, research has shown that every dollar you spend on patient awareness, actually you save $4 on care. So it's a 1:4 ratio, right? Similarly, this can be used to generate videos and very immersive content for healthcare professional training. So when you're bringing out a new instrument, especially, you know, surgeons who are in tier 2, tier 3 cities, they don't know how to operate many of the modern instruments. If something new is coming to the hospital, the HCPs could be easily trained using AR, VR kind of thing, and on a virtual cadaver, they can practice and see what they are doing wrong and all that, right? The third place where generative AI finds usage is what I talked about, behavioral health. So patient nudges, like, hey, you haven't taken your medicine, right? Or something like that. How can you create very engaging content that doesn't, you know, feel like a lecture, but still conveys the message to the patient? This is also a very important place where AI can be used. Now we come to the other side of AI, which again we work on, which is called edge AI. This is important for healthcare because often in healthcare, just in time kind of inferences are needed. Often in healthcare, we see that the devices are not connected to the internet due to privacy and security reasons, right? So taking the data to the cloud and then doing everything there and pushing the data back may not be a very feasible model. So the first application that we talk about is ECG based AF detection. Now this is what exactly Apple Watch also does today. However, if you look at the latency of Apple Watch today, it is 24 hours. So if you have something today, it takes 24 hours for Apple to give you a notification that you had an AF, right? So if that latency is still 24 hours, suppose I'm going on a travel or something, I have some paroxysmal AF I'm unaware of, I may start, right? I may start on the bus or the train, and then I discover that I am having a cardiac. It causes undue stress, right? What if I can tell him in 30 seconds of the event that you have? It may not be that how how great or how accurately I'm giving a therapeutic value, because if he or she goes to the hospital, the doctor will take care of it. What we can tell them is something is wrong with you, and this is probably the burden of wrong. So that's why what we have tried to do is on the device itself, on the watch or on the Holter monitor, we have added a intelligence using this tiny ML to actually tell people the burden of AF when they are using the device. So how much in the last 24 hours was the time you were in AF, right? And where you an AF, where you in an atrial fibrillation episode, just like within 30 seconds. So you can get average, like you can get the burden over a week, and you can get real-time updates within 30 seconds. So that actually tells people very instantly that there is something wrong, and they would like to visit the cardiologist or the electrophysiologist, whoever their treating physician is. The second, again, it was a requirement from one of our customers, is that how do we make these diagnostic imaging systems better? So can we detect tumors as the endoscopy is happening? So right now, if you know capsule endoscopy, they put a capsule inside your body, they take the sample, they take the biopsy, and then they take the biopsy result and then they send it to the
Hello, sir. Hello.
Hello, can you hear me now?
Yes, sir. Now you are audible, sir.
Okay, so how much did you miss? I think somebody muted me.
Just
It's okay
just
now.
30 second. It's okay, sir. It's okay.
Oh, 30 seconds. Okay, okay. I'll just continue with the lesion detection. So the
Okay.
lesion detection is meant for devices that are swallowed by the patient. Like these are called capsule endoscopes. And after being in the body for like 8-9 hours and moving through the GI tract, it passes out through the rectum. Okay, and then the device is collected or it disposed depending on the nature of the device. But you get this 8-9 hours of video feed from the device. Now the thing is that the physician, the surgeon, has to sit through this entire 8-9 hours of video to actually find out lesions, bleeding spots, and all this. So we try to say if we can add a small AI model onto the capsule itself, which can tell you and annotate, like you do have those bounding boxes, it can draw bounding boxes onto the regions where there is a possible lesion. Then it will make the life of the doctor much easier. They can just look at those spots and identify what is the lesion, what is the bleeding spot, what is the dark spot, and all that. It doesn't have to frame by frame go through the entire video in the first look. They can do a sanity check later, but at least at the initial level they are given inputs. The third application that we talk about is smoking episode detection on wearable. So again, why edge is needed? Because accelerometer data is usually very high sampling rate. So we cannot practically send 24 hours of data upstream to the server. So somehow we have to compute the puff, the hand to mouth gestures on the wearable itself, pass them onto a mobile phone where a time series analysis can be run on them, like a HMM kind of model can run, which can tell me when an episode is done. Now, why both are important? One is puff is important to give the patient real-time alerts. Right? You are again smoking, that kind of alert if you want to give, that is the puff detection is good for that. The mobile is good because all risk models actually work on pack a day kind of score. So which means how many packs a day you are smoking. So you have to detect episodes and convert them to packs, give them the risk scores, and also tell them that look, yesterday you smoked only 2, today you already had 3 cigarettes. Like this kind of charts you can give them. Like just you give your sleep score, you can give your smoking journals. So that is why we have here again that tiny model is very important. So here we show a small demo of one of the tiny models, which is atrial fibrillation. So this is how the leads are designed, as you can see through a breadboard, and this is connected to Arduino Nano. So the entire model is running on this Arduino Nano. There's no external, cloud connectivity or anything needed. It's a very tiny model, 176 KB, that is running on this device. And on the device itself, it can analyze and tell you whether you're having an atrial fibrillation or not. So this is the data transmission happening. And on 1 minute data, it is predicting whether it's normal or AF. Yeah, so this is another model that we created. This was again, this is not a tiny model. This is a cloud-based model. So basically the idea is many people, especially during COVID, you must have seen many people have moved on to workouts in their home. Now, when people exercise in the gym, usually there is a trainer or an advisor who tells you the rights and the wrongs. But when we work out alone in a place, then we don't know what we are doing right and what we are doing wrong. Even if we have a mirror, because we can't simply look at the mirror and do things always, right? And the most risk that we put ourselves into is the spine and the neck, right? Now, what we tried to see was that using a mobile phone camera that everybody has today, the front camera, can we actually determine when we are going ergonomically wrong, right? That means we are rounding the back or pulling the neck up. So we tried to explore the existing models like MediaPipe or OpenPose or this. We determined that those are meant for a different usage, for a different application. Their joint points are accurate. They extrapolate or interpolate the kind of key points within the back and neck. They are not interested in those. They are more interested in the hands and the feet. So we actually created our own model, which can have these points, like you can see the below one, the TCS approach, that we can detect this angle in the back, we can detect this angle at the neck. And if you're not wearing a very loose garment, like a really kurta kind of garment, we can with some robustness detect how your ergonomic pose is during an workout. And this now can be integrated with a a musculoskeletal model to give you the muscle load for a given pose. Why this is important, especially for athletes, is that when you are doing an activity, you are putting a load on a muscle. Now, that every load that you put comes with a risk of injury or a risk of a tear of the soft tissue, right? So this can tell you actually the risk of injury or predict your injury if you hold this pose for too long. This can be used for athletes. This can also be used for workers who are working on a manual kind of work, like lifting heavy loads or something. You can like in plants and factories, you can actually monitor the wellness of or well-being of the workers. Again, a small demo of if this is a real-time thing, like I'm doing a squat and here is my reconstruction of my pose, right? Sorry. Yeah. So now we come to the other part, which is mobility analysis. Now, smoking is also a kind of mobility analysis, but here we had a harder task to perform. So the idea was that if we gamify stroke rehabilitation, right? So people who are recovering from a stroke, how do we understand how much their hand-eye coordination, their fine motor skills have recovered? Now, fine motor skills are hard to determine because their noise or their error in the fine motor is also very tiny, right? So one part is we can use a very advanced kind of sensors like AR VR kind of motion labs kind of environment, but that becomes very costly, right? So we said if I am wearing a simple accelerometer on my wrist, how much I can do. So here again, what we did was we designed a neural network that actually tells me the direction of the stroke data, and then we had a linear model that could uh, tell me the magnitude. So we got the magnitude and the direction in the 3D, and then we reconstructed the real-time trajectory. As you can see here, we could actually enable this to write in thin air. So you can actually sign and we can tell what the strokes you have made. So it has that level of accuracy. And you can see it can be used to do something like this. Yeah. So here the person is wearing a VR glass and is shown with a set of drums. And the ask is that you're not seeing here, but in the VR which needs to be played, right? And the thing is now you have to play this. So it actually so here is the guidance pattern. So now he has to follow. So what are you testing? You're testing the memory, you're testing the coordination. Not only that, you're testing the speed. So the response or time also you're testing, and based on that, you're scoring. So this score becomes now a guiding scale for the physician, uh, that how good the recovery of this patient is. Now we move to another disease, which is Parkinson's disease. It's a very, neurodegenerative disease, mainly geriatric, but is, there is no cure. So the best shot we have is management. Now, one of the biggest challenges of this Parkinson disease is what we call freezing of gait. So as you know, that any kind of motor disorder, if you're having, your gait is, the walking gait is affected. But in Parkinson, the trick is that patients have on and off phases. So when you are in off phase, your gait will be absolutely normal. And when you come to on, certainly you will feel like you can't move anymore. And the result, they fall. So this phenom is called freezing of gait, right? FOG. And this is the reason for maximum amount of fall and injury in Parkinson patients, right? Now, one thing is obviously detecting this freezing of gait. But if you are detecting, that means it has already occurred and the reaction time is not there. So what we thought was that can we forecast this fog. So there is something called this pre-fog window. So within this time, can we actually forecast? Then we can prevent before this happens, right? Somebody can just simply get up and hold that person, or some visual or auditory cue can be given to that person, and it actually works. Research have shown that some auditory cue, something as simple as auditory cue, actually can prevent severe injuries. Now, there was this, data set that was available for FOG on patients. So it has multiple sensors, lot of sensors like shoe, belt, torso. So as you can see, STB, and then also in the shoe, there are multiple sensors. So we found out that if we put so many sensors on the body, first of all, it's going to become very tedious for the patient. Second of all, it's only going to jack up the cost, right, of this. So we said how we can get a reasonable accuracy with a very tiny model that can run on the shoe and with minimum number of sensors. So we took just one accelerometer sensor on the heel, and we were able to get to a reasonably good accuracy, 88% accuracy of detection of pre-fog and fog, right? And we could forecast that to avoid the fall using just one sensor. Obviously, if we use all three sensors, we'll be near this score. But we are the only ones who have tried with just one sensor and a very tiny model to actually reach good accuracy. This was published in ICASP, I think 2022 or 23. So here is the video of real-time gait analysis using our insole device. So this shoe that you see, this prototype, it doesn't look very beautiful, but it was completely created by us, and that is why it's so bad. And the wires coming out and everything. But the thing is that these few piezoelectric and frugal accelerometer sensors can actually detect the entire 3D spatiotemporal parameters of gait, which otherwise you have to go to a motion lab or a gait lab to get tested. Obviously, there are some parameters that we can't do, but the major ones that are of importance, like center of pressure, vertical ground reaction force, cadence, stride length, stride height, and the balance, all we could do using this simple shoe. Now we come to medical image analysis using AI. So here you look at how big this area actually is and how big we work in almost all of these areas, right? So it's impossible to cover in a single session. However, I will just show you a chart of what all we do here, right? And what all can be done actually. So what are the problems? So you can do anatomical landmark detection. So when we say anatomical landmark, it means in an X-ray, can we detect the key points that are detected by a surgeon for planning the surgery? This is non-trivial because in X-ray, the scaling is different, the angles are different. So the surgeon also puts their mind as to detect these points. So can we help the surgeon in planning the surgery faster and better? Right. The other part is data redaction with this, new GDPR and every privacy law, EU Data Act and all that. It becomes very important that pharma companies or other research institutes, when they capture this imaging data, they actually take care of the anonymization of the data, right? So these data redaction using AI becomes a important challenge. So this sits in directly in the PAC system, unaided, and you can just run this, it redacts, and then you can take the data out, right? So that way you're not touching the the PII data. Similarly, I already told you about bleeding spot detection in endoscope images. You can work on fundus camera to detect things like diabetic retinopathy, coronary artery disease. You can do classification of different types of glaucoma, right? And similarly, you can do cell detection, all this.
Hello, sir. Am I audible, sir? Sir, sir, you are not audible, sir.
For some reason.
Okay, sir. No issue.
No problem. I'm back, I think. Yeah, so I'll
Yes.
start again with the wound analysis. So basically what happens is you take a mobile phone and you take few images of your wound, and what we tell them is how well your wound is healing, how fast it is healing, and how you're doing with respect to your past. Correct. So for that you need to measure the wound, and not only measure, you also need to understand the color properties of the wound. Similarly, there are a lot of things you can do, from CT, MRI, detect, data, laparoscopic video, and all that we have done. And we can also do a lot of work on X-ray, where you can obviously disease identification is one big part of X-ray. The other that we have already done is implant manufacturer detection. So meaning what happens is sometimes, especially you see in India, this happens that people come in and they have some kind of, implant inside their body, like a plate or a knee or something, and it's been quite old. So they have lost the records or they don't have it with them. And now the treating physician or the person doesn't know what implant is actually there. However, each implant has a signature, and if we look at the X-ray using AI, we could match it to the template of the manufacturer, and we can tell them exactly which manufacturer and which model this implant belongs to. So then which implant this person is having. Few examples here. I think bleeding spot detection we already talked about. Implant manufacturer, segmentation again. So this segmentation is a little different than usual image segmentation. Basically, when we segment this cardiac image, we segment them into the anatomical regions, meaning the myocardium, the ventricles, the aorticles, like the way the doctors segment. We try to do it similarly from CT and MRI. This is again very important, because when the doctor looks at the heart, they look at these anatomical regions and try to understand what is wrong with which region. And if that automatic segmentation is done, it becomes very easy for them to operate, not operate, plan the operation, I would say. So this is something like text data. I already told you there is a lot of text data, and it's very valuable, including social media posts from patients and subjects. So this is the work we did, basically nursing notes analysis. So we looked at caregiver notes, prescription reports, and predict ICU length of stay. Similarly, we looked at clinical trial descriptions, and we could match the trials with the patients. So one side is the patient EHR EMR, the other side is the requirement for the trial. Now the thing is that how do you match them? Because both may not be written in the same language. For example, in the trial, the exclusion criteria could be pre-diabetic, right? Now that means that translates to an HbA1c level of something like 3 or below, right? So these kind of text understanding and matching using an LLM, that is something we have done. Similarly, you can mine adverse drug effects from a large amount of EHR EMR. Any regulatory authority, they actually do this today. It's called signal detection or pharmacovigilance. So this again can be largely automated through text analysis. And also not only text analysis, a lot of physiological signals can also be analyzed as and when available to understand how the drug is interacting with people of the different genetic pools, people of different comorbidities, people taking different other drugs, drug-drug interaction kind of thing, and also drug-gene interaction. Now, in India, people are also talking about drug-environment interaction, because so much of pollution that we live in, often we are seeing that certain drugs are producing unwanted effect due to the side effect of pollution. So it's a new paradigm. Probably we also have to look at the environment data of that region. Now we have almost covered the purview of AI in healthcare. This is a smaller segment that we have on quantum in healthcare. But before that, I would like to take a pause. If you have any questions, comments, feedback regarding the previous one, you can ask me. I'll be happy to answer.
Participants, if you have any question, then please raise your hand. If you have any question, okay. Sumit Kumar Bhatsamisha, please.
When we talk of AI in healthcare, then again we are always concerned with the safety also. That is of most important thing. So nowadays we have seen that I personally have seen some doctors who are suppose even for small thing they are taking the help of AI and online platform to listen to the patient's problems and generate the medicine list. So they are taking, so how safe they are, because that online AI
So
platform that can be hacked by someone, and then they may give a wrong suggestion also, so it could be misused also. So safety is of paramount importance.
You're right. So basically in US, there is a body called FDA. In India, there is ICMR. So anything that has to be used clinically is actually certified for safety and patient efficacy by these bodies. So if anybody is using an uncertified platform, I don't think it's legal to use any uncertified platform for a clinical practice, right? So I can't
Yes,
comment
sir.
on what is going on, but essentially there are safety, guardrails that are there in place. There are regulatory authorities that certify, and that is why there are clinical trials and all these paradigm exists, that you have to show your efficacy and safety before you can use it in clinical practice. Yeah.
Yes. Thank you, sir.
Rajesh Mukherjee, please.
Am I audible, sir?
Yeah, you are audible.
Yes.
Yeah, sir, I just would like to know a little bit more about the project you have told about, that the wound repairing prediction you have done, that over the time by taking the snap of the wound, it will tell how much it got cured. So I just would like to know that, have you taken the different people wound over the different phases, and based on that you trained and model and you made that predictive system? Or basically, actually, I want to know a little bit in details, if you like to share.
I'll tell you what we did. Yeah, definitely. So I'll tell you what we did. So basically what we did was we took the image of the wound from 2-3 different angles, and we tried to find the correspondence point like you do in stereo vision, right? So you know about stereo vision, right? If you have two eyes and you look at the same thing from two perspectives and you find the correspondence points, you can actually measure not in pixels but in centimeters. You can give the measurement, how much is the depth, how much is that is the basis of 2D to 3D conversion and all. So we took that approach and we measured the wound in 3D. So you have n number of 2D measurements. And why it is possible? Because the phone also has an accelerometer. So once you move the phone, you using the accelerometer, you can understand how much you have moved in which direction. So you know the rotation translation of the camera, and you also know the now you have to determine the correspondence points, right? Now that is a tricky problem, but using solvers, you can actually find it using graphics solvers. So actually our main contribution was, how do we port these graphic solvers onto Android and iOS, right? So that is something we did. We ported Ceres, OpenCV and everything onto Android. And then we ran this simple model to get this correspondence. Now, where AI was used was in segmentation. You have got the pixel to earth dimension, all right, but how do you know the boundary of the wound, right? So there we use segmentation to actually in 2D get the boundary and then extrapolate to 3D and find out the volume of the wound. So the depth and the area, right? Using the geometry, you can find the volume of the wound. Now, over time, you can just look at one parameter is the volume of the wound. Any wound that is healing will become smaller and smaller over time. Correct. That is one aspect. The other is if the wound is going in a bad direction, there will certain colors that will show up, like green, like black, right? And so these we got from the the physician, from the doctor, that if a wound is becoming bad, then these are the colors which will dominate. So we found that in HSV domain, actually we could do very good clustering of good wounds versus bad wounds. So we took the image, transformed it into HSV domain, and we did a clustering to find out good versus bad. So that was the other one, right? So combining these two, we gave some kind of a mobile dashboard to the patient, saying that your wound color is not looking good, and your wound has not healed in the past 3 days. You have not reduced. So that inference, if is given to the doctor, can take some corrective action, maybe give some medication or something. I hope that answers.
Thank you. Yes, sir. So that means it was an excellent idea, the first one, and also you have you have collected the ground truth based on the color.
Yes. Actually, we collected the ground truth from a doctor. The doctor gave us the images. He also told the history of the patient. So we had the entire picture before we started. Yeah,
Thank
definitely.
you very much, sir. Thank you.
Because that domain side we don't know very well, right? That only doctor can tell.
Yes, sir.
Okay. Okay. So I move to the quantum one. Now, quantum, as you know, is a very early stage technology right now. So if you look at quantum technology, there are only few applications that have been implemented in healthcare or have been tried, but I'll try to cover them. So quantum tech, if for healthcare, is divided into three broad, buckets, if you can say. One is quantum sensing. So quantum sensing means something like, a quantum magnetometry or quantum electrometry, which has been there for quite some time, right? But of late, certain, this NV center and spin electronics that people have invented have actually boosted the accuracy or the precision of these instruments. So this quantum sensing is being used very commonly for applications like drug discovery. I'll tell you how. So suppose you have taken a tissue sample out of the body and you have applied a drug. So this is called trial on a petri dish, right? So you take a tissue sample out, you grow it there, an organoid model on a lab, and then you apply a drug and see how suppose this is a disease sample. So suppose it's a piece of brain having Parkinson, right? Now you give a drug and you try to see if the cells are improving, right? Or it's a brain tumor cell and you're giving a drug and trying to see if the tumor dies, right? So tumor dying means it will behave like a toxicity. And if a brain has a toxicity, the S1, S2, or the response to an electrical impulse will keep reducing until it dies. So earlier, because the sensitivity of classical instruments was low, this organoid trial would have taken 7 days to actually give the first report, and then you can decide on the next target molecule. Theoretically, this 7 days can be reduced to 7 minutes in the quantum domain, because it is such a sensitive signal that it can detect changes in a single cell. So if you can detect if a single cell is getting affected, positive or negative, you know your target molecule much faster. So it can accelerate drug discovery the way it is done. Second is prosthetics. Now you're seeing prosthetics has emerged quite a long bit, but what people are unable to do right now in prosthetics mostly is fine motor movement. Like if you want to play a guitar or a sitar, it's very difficult using a prosthetic limb because it requires very fine control over fingers and all. Now, with quantum sensing of the brain, you can actually detect very fine neuron activity, which can translate to fine motor movement, and you can design a bioprosthetic that can actually allow you to play a sitar or a guitar. So these are the kind of thing that are used. And the third is forecasting. So for example, say now you have only 12 lead ECG, right? But quantum MCG signals, that is magnetocardiogram signals, are saying that they are as good as a catheter system. So that is put during surgery into your heart. So imagine being monitored with that high density 24/7 and the ability to do it, right? It will definitely lead to much better forecasting of cardiac issues even before they occur. So that is another area which is being looked at. If we look at quantum computing, again, quantum computing is being used for drug discovery because it's a large space, right? The molecular space is very large. So if you want to automate drug discovery, you need to come up with a very rapid and very fast way of computing, which quantum computing provides. One interesting one interesting implementation that has been made public is that of donor matching. This was actually done by Accenture. I'll cover this in the next slide. So what it said was you have this list of donors for kidney and you have this list of recipients. Often we match donor and recipient, but we see that the best donor doesn't get the best recipient and the organ is rejected and the kidney is wasted, right? So using, because this happens because there are so many parameters to match that it's not possible using the current technology to actually find the perfect donor recipient match, right? But quantum can take you to that high dimensional level and provide you practical computation within short time so that you can actually do that donor matching, right? Similarly, quantum chemistry is something that has been there for long. It's not a new technology, which is basically spectroscopy or spectrometry, but it's becoming smaller and cheaper, which is accelerating not only drug discovery, but a lot of pharmacovigilance as well. Having said this, let's move to this. So basically this was I've given the link. So the idea was that how do we match optimal donor recipient using quantum computing. This was implemented on the D-Wave quantum computer, and it was done largely by Accenture. And basically it provides you a computational framework for matching kidney donors to recipients and tells you what percentage matching is there for this kidney to fit the donor. So this can improve the the efficacy of kidney transplants to a large extent. Now we look at some application of quantum sensing for healthcare. So here we look at this magnetometer probe, and these kind of things can be done. Neural activities and all, this can be used for drug discovery, as I was always talking about. This was published in Nature Scientific Reports 2023, not by us, but it was published by one of our partners. We work with these institutes actually. So again, you can record muscle activity, brain activity, and this can lead to much better prosthetics and exoskeletons. Again, something that was published in Quantum Science 2022. This was, this biomarker for rapid clinical testing was published in Nature 2021. And this is the quantum magnetometry of heart, which can give you much better forecasting ability. This was again published in Physics Letters 2022. So again, brain, metabolic MRI can be done at cellular level, which can help us understand metabolic diseases of the brain. So this can be possibly used when a person has mild cognitive dissociance or mild cognitive impairment, which means they are not yet into Alzheimer's, but they are showing signs of brain aging, that forgetfulness that comes with age. Right now, their NMR studies, quantum NMR studies can tell you the metabolomics of the brain, which can tell you how the protein degeneration in the brain is occurring, and can give a very good predictor of how many years it will take for the Alzheimer's to set in and progress much before time. This may lead to better treatment discovery. It may lead to better management. So that's, and for clinical diagnosis of epilepsy, this is again something. This is hard because epilepsy happens to happen all over the place. So you can't have a shielded study like your MRI. So unshielded quantum sensing is very, very difficult to do because the Earth itself is a large magnet, and there's a lot of noise that comes in. But yes, that is again something that we are looking at as a future of quantum sensing for healthcare. That's it from my side. Any questions about the last end?
Any question?
I think there are a few hands.
Sir, I have a question, sir.
Sure.
How can we ensure data privacy and protection while processing sensitive information and in Edge AI application?
That's a very good question, because right now what people are thinking is that because the data is not leaving the patient premises, it is the patient phone where the data ends, right? We are processing at the edge. So it is secure. However, in my opinion, it is not, because we see that phones are getting hacked every day, right? So how now do we secure these tiny devices which are resource constraints from getting hacked? And there are schemes and methods, and actually we are one of the ones who have bought out this issue, and we are working with the Bureau of Indian Standards to work out into protocols and frameworks that can enable security into body area networks, because it's a largely overlooked field at this, and it's a very good field for researchers to also try their hands at how to build frameworks and stacks that can enable security while maintaining the low power, low compute constraints of an embedded system.
Sir, one more silly question is that, but you were saying regarding this textual prescription, whenever the doctor prescription, they are making prescription. And so is there any privacy we need over there, privacy protection to must maybe can be ensured over there? Is there any
So I
need,
think
sir?
these so these platforms, definitely there is need for privacy, but I think platforms like Ayush or NHS in the UK, or NHI in the United States, they are already, I think, have taken care largely of the EHR privacy. So when you put your, let's say, your e-prescription into your DigiLocker in the Ayush, already those guardrails are in place. So I'm not aware if there is a threat in the existing methods, but definitely privacy is needed, and I think privacy is taken care also in those platforms that governments have provided. Yeah.
Sorry, sir. I beg your pardon about the name Ayush and what, sir? Ayush and
So there is this platform that government of India is coming up with, which is unifying EHR. So saying that if you travel between hospitals, your prescription, your everything will remain with you, and there is a login password and biometrics using which everything will lock. And I think they have taken care of the privacy part using the credential and biometrics and everything. But definitely it is a very sensitive data, and definitely we don't want our prescriptions to be hacked, but or misused against us, right? However, I think I'm hoping that the governments who have created this platform must have taken care of that. And obviously hospital platforms, as you know, they are very secure. They don't even allow anybody to log in, only the doctors. Or it's very on-premise kind of setup that they have.
sir, one more, I think one rise up hand. Mr. Rajesh Mukherjee. I would request anyone,
Hello.
please. Yes.
Hello. Yes, sir. I would
Yes,
like
yes, sir.
to
You are
ask.
audible.
Yeah,
You
sir.
are audible, sir.
I would like to ask one question that sometime we face that a particular model is doing very well in a particular data set and a very similar kind of data set, uh, a different data set of very similar kind of instances, that particular model is not performing well. So
Often.
sometimes we find that means I'm taking little bit of time. Uh, so for example, that for a particular data set, if you train the model, it's doing very good accuracy. But using the trained model, if you want to predict some different data set of same kind, it's giving lower accuracy. So in such kind of scenario, what's supposed to do? Both the data set should be combined, and based on that, the training should be done, or the data
If that is
synthetic
possible,
data.
yeah.
Yeah.
So that's again very good question. So basically, see, this is called out of vocabulary problem, right? So you have trained on one data, and in that data it is providing very well. Now you have checked the KL divergence between two data sets is not very high, but still it is not performing well on the other data set. So these kind of problems are actually hard to solve. But however, we have seen that sometimes it is because your model probably has overfit to the data. So to generalize, you can use techniques like dropout or random layer selection, something like that to generalize. But that would definitely mean that your accuracy on the training set also will reduce a little, right? Now, how to maintain the high accuracy and also scale across data sets? We have found certain techniques, like it's just from experience. I'm telling you, there's no golden rule. From experience, what we have found is if we normalize our data well, usually that takes care of a lot of things. Like usually what happens is the scale of the data, very simple things like the scale of the feature is different, or some representations are different somewhere. So if we take care of all that, we normalize the data, curate the data very well, the training data that we are using, we often see that with a little dropout or something, it scales well and generalizes well across data sets. But having said that, in healthcare, there is a big problem of demography, right? So if you have trained on Indian data and you work on Chinese data or European data, it will not work even though the data is very similar. This is because of the inherent change in the metabolism of these two people and the genetic makeup, right? So there you have to take a little bit of their data and do some transfer learning, kind of thing to actually make it work. There is no other way. Otherwise, you have to put the entire metabolic changes somehow in the model, then it becomes very complex.
Okay, sir. Thank you, sir. Thank you.
Apart from this, anyone want to ask any question? Okay. Let us, with your permission, sir, shall we go for conclude this session? And before that, I would like to say this session highlights the transformative role of AI and quantum computing in healthcare. Key topics included the use of Edge AI on devices analysis, generative AI for the patient's engagement and training, and advanced medical imaging technique for accurate diagnosis. So add on to that, there was quantum computing application in donor matching, drug discovery, and quantum sensing for clinical diagnostics were also discussed in a very well designed manner. Thank you once again, sir, for delivering us this great session, and we are very much feeling we are very much getting this opportunity. Hope this opportunity will carry on from you again and again. Subrato sir, over to you, sir.
Okay, thank you, sir. Sir, with this, I want to add just one or two more points with it. Sir, Avik sir, around 150 plus always. Right now it is 157, 158 participants across India from 60 different institutions were attending your session. And thank you, sir, for your nice and informative and very easy presentation. That will be beneficial for all of us. Thank you, sir. Thank you very much. Sir, with your kind permission, should we conclude this session?
Avik sir.
Avik, sir?
Yes, please, please. Absolutely.
Okay, thank you, sir. Thank you so much.
Thank you. Thank you.
Thank you, sir.